That's what I thought it was anyway. Senator Moran.
Mr. Chairman, thank you again. I want to go back to a couple of topics that we visited about earlier, Secretary, and then add a third one. Back to the IPAB, I want to make sure I understand that you indicated that there was a justification for not including critical access hospitals in the provisions that eliminate the potential for the independent board's decision. Does that continue? It expires, and does something need to be done now, or are they safe for a while?
All I was suggesting, Senator, is that I am speculating that the reason that critical access hospitals were treated differently in the original proposal was that critical access hospitals are paid differently in the current system. So their payment protection stays in place at the law requires that they get paid based on cost, and that is not the case of other hospitals.
Do you support exempting critical access hospitals from the IPAD through 2019 like the other hospitals?
Well, I would be supportive of taking a look at what the proposal would look like. I share your concern that critical access hospitals are vitally important, and I just need to look at all the framework that protects them right now.
I actually think that because they're paid differently, they may be a greater target. But there's a justification that apparently you and I share for why they're paid differently. On my other question about the so-called doc fix, is my understanding that the administration has a plan for 2012, 2013, but no concrete plan beyond that?
We have not proposed 10 years of offsets. As you know, up until probably a year ago, the doc fix was done in a limited fashion, a year at a time, and never paid for. I think the President has said it is important to pay for it. He has proposed not in this budget to have what amounts to about 2.5 years of pay-fors going forward, and says we look forward to working with Congress on a permanent fix for this situation.
Well, I've made my position clear on the Affordable Care Act, and that's known. But regardless of your position on that legislation, the system falls apart if we don't make the doc fix substantial and permanent.
There's no question, and I've said that since the outset. And as you noted, I mean, the Affordable Care Act is not what caused the gap in payment, and it isn't what will fix it. It really is, I think, something that needs to be discussed in the overall Medicare system.
I fear that that part of the potential demise of our healthcare delivery system will be related to the government's reimbursement of healthcare providers, its inadequacy, and we will potentially have more providers paid for by the government under the Affordable Care Act. And if you add more people, more providers who are paid at a rate less than what it costs to provide the service, we lose the physicians who provide those services. We lose the hospitals that deliver those services. And so this seems to me to be an overriding consideration that we just have got to get to. Finally, your successor's successor has asked for a waiver under the MOE, and
My successor's successor.
yes, that true?
Who is my successor? I don't know what we're talking about.
It depends on what position you. That's true. You've held so many positions. You're the current governor of the state of Kansas has asked for a waiver, and I am interested in knowing the status of that request and what criteria that you have in place or will put in place to make those determinations.
Well, it's my understanding, Senator, and I think this is the most updated information, that while there has been some suggestion by Governor Brownback that he would come to our office with some specifics, we do not have anything other than the notion that maybe a waiver would be a good idea. As far as I know, we have no paper, we have no proposal, we have no notion of what it is that he's talking about. We are working actively around the country with states around not only what they can do to lower their pressing health care costs, but ways that other states have taken advantage of the current law to deliver more effective services at a lower cost, and would look forward to working on Kansas or any other state, but it's my understanding we really don't have anything other than a letter saying we're going to come to you with a proposal.
Thank you, Secretary. Appreciate your, our conversation this morning, Mr. Chairman. Thank you.
Thank you, Senator.